Hi there, this is Dr. Evan Osar with the Institute for Integrative Health and Fitness Education. Welcome to this edition of Integrative Movement Insider. And this is part 2 of a 5-part series on the best core exercises, otherwise known as the 3 secrets to training the core. Because so many of your clients will present to you with chronic issues like low back tightness, discomfort, and the inability to perform at the levels they need to and or want to. They may feel weak, or they may not be able to activate or feel their core muscles working properly. They may have chronic hip issues or shoulder and neck issues related to how they're using their core. So this information is so important to you to become that specialist, or in your process of becoming that specialist that your current clients need and want to help them safely and effectively accomplish their health and fitness goals, and also attract more individuals that need and want your expertise. So thank you for joining us in this series. Remember, in part 1, so if you missed that, make sure you check that out after you watch this video. In part 1, I shared with you the very first secret. And again, these are not really secrets. I just call them secrets because people love to hear secrets. They're really the strategy to helping your client create their most optimal and efficient strategy for using their core, and essentially for using their body and creating that optimal and efficient posture and movement strategy. And this is just using the core appropriately, because too many of our clients have been taught strategies. Too many of us as health and fitness professionals have been also taught incorrect, or maybe not as optimal and efficient strategy as we could have learned, which actually creates and perpetuates many of our clients' issues. So in secret number 1, I shared with you, many of our clients have been taught to pull their abs in to stabilize their spine. And this can create more abdominal stiffness, or feel as if the individual will feel as if they're really using their core. However, what it actually does is it changes the alignment of their lumbar spine and oftentimes their pelvis, because as they activate their abdominal wall and pull it in, they're pulling their pelvis into posterior pelvic tilt, and subsequently also flattening or flexing their lumbar spine, which will actually increase stress upon the discs of the low back and create and perpetuate disc-related issues in so many of our clients that have low back pain and or chronic issues such as tightness and or weakness. And a lot of times our clients are so gripped down with their abdominal wall, they can't even feel their abs working because they're so gripped already, and they're not perpetuating the right stereotype for how they should use their abdominal wall. Because remember, the number one purpose of our abdominal wall is really to maintain alignment of the rib cage over top of the pelvis, or the pelvis maintain alignment and control of the pelvis underneath the rib cage, and really to decelerate extension. So as we're walking, the abdominal wall decelerates extension and rotation. It doesn't create flexion. Its job is not to pull in, to draw in, to create posterior pelvic tilt and or lumbar spine flexion, even though it can do that. The abdominal wall can do that. It's really to facilitate control, alignment and control of that thoraco-pelvic cylinder. So the thorax on top of the pelvis and the pelvis underneath the rib cage. So the second secret to developing an optimal and efficient strategy for using the core muscles is to, again, train neutral alignment. Teach the abdominal wall and all the core muscles how to maintain neutral alignment before moving out of neutral. Because today I'm going to day 2 of the International Fascial Research Congress, and one of my mentors and teachers is Dr. Paul Hodges. I've learned a lot from Dr. Paul Hodges out of the University of Queensland in Australia, and he's influenced a lot of my thinking on how I train the core and how I think about training the core, and some of these strategies that we use and teach here as part of this series, as part of our certification courses, the Integrative Corrective Exercise Instructor Program, as well as the Integrative Movement Specialist Program. One of the things that he really shared with us, or I should say shared with the industry through his research, is the difference between the deep muscles and how they react and how they actually pre-contract or pre-activate prior to motion to help stabilize the trunk, spine, pelvis, and hip complex in individuals that don't have low back pain. And individuals with chronic low back pain especially will demonstrate delayed activation of muscles like the transversus abdominis. There's also been research around the multifidi by Richardson and Hides, and there's also information around the pelvic floor, very similar, that in individuals that have chronic pelvic pain and or low back pain, a lot of these deep muscles don't activate at the same level, or I should say at the same rate, meaning they don't activate as quickly, they don't pre-activate prior to the prime movers or those larger muscles. So one of our strategies is to help our clients reestablish neutral alignment, because that's been the position that helps our clients or helps individuals actually activate those deeper muscles and basically helps them stabilize the spine, the trunk, spine, pelvis, and hip complex, the core, in a more optimal position. Now, the next question is, what is neutral? Because neutral seems to be a little different depending on who you talk to. If you talk to a Pilates instructor or yoga instructor or personal trainer or rehab specialist, neutral is sort of this ambiguous sort of term. So let's just leave neutral for neutral right now. As I come back and describe the third secret and then move into the exercises where I actually demonstrate what neutral alignment is, it will make more sense. But for now, let's just leave it at, we want to help our clients create their most optimal and neutral position of the thoraco-pelvic cylinder, the thorax, lumbar spine, and pelvis, and maintain this initially through their low-level progression. So their initial core exercises, they should be able to maintain that neutral alignment, their most optimal and efficient neutral alignment, as they move into their core exercise progressions. And as I mentioned, as we move into parts 4 and 5 of this series, I'll demonstrate exactly what neutral alignment looks like, how to help your clients find it, and then also how to train it. So secret number 1, stop gripping the abdominal wall, stop pulling the abdominal wall in, and changing alignment of the pelvis and lumbar spine. Secret number 2 is help your clients establish their most optimal neutral alignment of the thoraco-pelvic cylinder, so the thorax on top of the pelvis and that lumbar spine position. And as I mentioned, we'll be back next week actually, with part number 3 of the series. And then as I go through parts 4 and 5, I'll actually demonstrate how to optimally activate the abdominal wall, how to get your client into the most optimal neutral position, and then activate the abdominal wall, where breathing fits into all this, so that you help your clients create their most optimal and efficient strategy, and really help them if they've been struggling with chronic tightness, discomfort, and or the inability to use their core appropriately, and or access their strength, their stability, their endurance, and function at levels they need to and want to. So again, thank you for watching. I'm off to the Fascial Congress. Make it a great day. This is Dr. Evan Osar with the Institute for Integrative Health and Fitness Education. Take care. Have a great weekend as well.